Tecvayli is an FDA-approved medicine for multiple myeloma, a cancer of the bone marrow that is used by adults who have not responded to at least 4 prior treatments. Tecvayli helps the immune system fight cancer cells by binding to them, allowing the immune system to recognize and attack the cancer cells. Indications: Tecvayli is used in patients who have already received at least 4 treatment regimens for their multiple myeloma. It is used when the cancer has come back and did not respond to prior treatment. How to use: follow all the directions on the instruction sheet. Read the patient-valid card about serious side effects and learn what symptoms to avoid for. Keep the card with you at all times. Tecvayli is given by a healthcare provider as an injection under the skin, subcutaneous injection, in the stomach area, thigh, or another area. You might be given other medications to help prevent serious side effects. Keep taking this medicine for as long as your doctor has prescribed. Your treatment with this medicine may be temporarily or completely discontinued if you have certain side effects. You will need medical tests before and during treatment with Tecvayli. Contraindications: to make sure Tecvayli is safe for you, tell doctor if you have an infection, pregnancy. You may need to have a negative pregnancy test before starting this treatment. May harm an unborn baby. Use effective birth control while using teclistamab for at least 5 months after LS dose. Tell a doctor if you become pregnant. Breastfeeding: do not breastfeed while using this medicine and for at least 5 months after LS dose. Precautions: if a journal has this activity for 48 hours after receiving certain doses of this medicine or until neurological symptoms go away, your actions could be impaired. Tecvayli side effects: get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of a face, lips, tongue, or throat. Tell medical caregivers if you have signs of cytokine release syndrome, a serious side effect, fever, chills, trouble breathing, confusion, severe vomiting or diarrhea, faster or irregular heartbeats, feeling lightheaded or very tired.